So yeah, we have to go follow the program here. So we'll go to the next speaker. It's Dr. Shantanu Sharma, Deputy Director at MAMTA Health Institute for Mother and Child in India. He will talk about gaps and scope of improving infrastructure in facilities for sustainable healthcare in India. The screen is yours, Shantanu. Yeah, we can see the presentation.
Good afternoon, everyone. So today I will be presenting about what are the gaps in the existing infrastructure facilities and what is the scope and how can we really improve the infrastructure in India for sustainable healthcare. So in the next 10 to 12 minutes, I will be touching upon these issues. To start with, I think it's important before we look at the gaps and what can we do as a scope, I think it's important to understand what is the healthcare system or how does it operate in India. If you look at the rural areas, at the bottom, if you can see, we have sub-center or health and wellness centers, which is catering to or which caters to people in villages, and it's the first level of the contact between the people or the population and the healthcare system. And most of the national healthcare programs are rolled out from this, and we have the presence of midwives at a sub-center. Moving ahead to primary health center in the rural areas, in the primary health center, again, this is the first level of contact between the medical officer or a doctor between the population. And so it's important, and we have some basic facilities of like these primary health centers. They provide preventive, promotive, curative services. Moving on to from primary to community health centers, it has specialists like surgeons, pediatricians, gynecologists, and physicians to look after the health of the population, and some laboratory facilities as well as in the blood banks in some of these health centers. And moving on to the district hospital, which covers or caters to a population around 4 to 5 lakhs in the rural areas, and it has most of the facilities and also 100 beds and more. In the urban areas, it's more or less similar. It's just that it works in different ways, but we have an urban health center to begin with, and then a community health center and a secondary tertiary. So urban health center caters to a population of 50,000 people with a doctor and nurse or the midwives. And moving on, and tertiary hospitals are the ones that are big, that have all the facilities of radiography and all the tests and operations. But surprisingly, I think this is the way the government health system works. But we also have the existence of the private sector in India, and surprisingly, 50% of the inpatient load is taken care of by private sector, and 77% of the outpatient load is taken care of by the private sector. So private sector has a huge role to play in India. If you look at these are the pictures from some of the primary health centers in India. And now let's move on to the gaps. If I look at the gaps in the healthcare infrastructure, like in my extreme left, you can see that what are the non-functioning health facilities. So if you look at like 25% of the sub-centers I just talked about are non-functional, and also around 5% of primary health centers are non-functional, and 1% of community health centers catering to a population of over 1 lakh, they are non-functional. Even if you look or talk about the health staff shortfall, as per WHO norms, if you compare, then 62% shortfall of the male health workers in our health facilities. Similarly, the lady health visitors who accompany or who helps midwives in delivery and other procedures or immunization, the 48% shortfall, and similarly 7% shortfall of doctors in facilities and around 4% shortfall of auxiliary nurse midwives if we compare this with the WHO norms. And if you look at the vacancies, there's huge number of positions of these health staff, they are vacant, and we have not been able to fill them with the different, if you look at the vacancy of doctors, 24%, 36%, lady health visitors, and so on. So that really highlights the gap in the existing healthcare structure that we have. Even if we look at the primary health center, as I just mentioned, it is the one or the first level of contact between a medical officer or a doctor and a community. So if you look at the primary health centers, 38% of the primary health centers, they do not have lab technicians, where basic like the complete blood count or the basic tests are conducted. Even if you look at pharmacists, 24% of these primary health centers do not have pharmacists, and in fact around 10% of these primary health centers do not have doctors. So that is something that we're lacking in. If you look at the community health centers, which are catering to a population over 1 lakh with physicians, specialists, but most of these, you can say 80% of these community health centers do not have surgeons. 64 to 70, you can see 64 or 77% of these community health centers do not have gynecologists or physicians, and around 70% of these community health centers do not have pediatricians. Beside the shortage or lack or gaps in the healthcare staff or facilities, even the hospitals in India are energy inefficient. I mean, this is the data that I've just taken from a document that was published way back in 2009. And if you look at how much is the energy consumption per bed per year, if you look at it, 750 to 1500 kilowatt hours per bed per year in a government hospital in urban area, and similarly 150 to 300 kilowatt hours per bed per year in a rural area. And on the contrary, if it's a private one, it consumes like that. So there is a huge energy consumption in our hospitals, and which is, and also how much it is costing us in terms of that. So there is, I mean, our hospitals are quite energy inefficient in that sector. And health sector consumes around 8% of the total energy in India. I mean, among all the industries and everything, in health sector consumes that. And not just energy inefficient in terms of we are generating a lot of waste that we're not taking care of. Around 1.5 million tons of healthcare waste is generated every year. So, and this consumption, which I was talking, is how much energy consumption is done in these hospitals or you say the nursing homes. The consumption is likely to increase. This was done way back in 2009. We don't have the updated data. So this consumption has risen over the years. So this is going to rise. So again, are we really monitoring the energy consumption in our hospitals? That is something we need to really look forward. Or are we understanding the energy efficient practices or the technologies that we need to look at? Are we launching any energy efficient or what you say conservation awareness programs, or are we implementing any energy conservation measures to meet those things? So there's something that we need to look at. And in fact, if you look about the water use, it's around 450 liters per head per day in our hospital. So it's huge, I think, not just energy, but water and waste as well. And above all, we do not have, I mean, we have data from few hospitals. When you have hundreds and thousands of health facilities across India, catering to a population of 1.2 billion, I think we do not have adequate and comprehensive data to look at. And even if I look at the energy consumption in hospitals, I think a lot more than around 30 to 65% of energy consumption take place in heating, ventilation, and air conditioning. At the same time, lighting consumes around 30 to 40% of the total. And if you look at the water, plumbing also consumes 10 to 12%. So there is something that we really need to look at, that we are not energy efficient, and how are we? Some other gaps that we have that are still there in the system, if I look at the system perspective, the number of doctors we have just have 7 doctors per 10,000 compared to WHO norm of 10 doctors per 10,000. We just have 9 beds per 10,000 population, and we just have 17 nurses or midwives. What are the other gaps? Yes, we do have delay in seeking care. People are not able to get the care in time. The facilities are already overloaded or overburdened. There's a lack of quality care in most of the facilities because of the overburdened facilities, the long queues, the waiting increase. The as I just mentioned, the private sector contributes to nearly 77% of outpatient facilities and around 50% of the inpatient. So see, the out-of-pocket expenditure is quite high, and unequal distribution, because better facilities, better hospitals are more available in the urban areas, in metropolitan cities, vis-a-vis if you look at the rural areas, the far-flung areas, we do not have adequate. So there's an unequal distribution of healthcare facilities, and I just mentioned that yes, the patient load is quite high for the facilities to tackle, and also around 8 to 10% of our primary health centers, they do not have the supply of electricity, do not have water supply. So, and similarly the sub centers, they do not have adequate supply. Around 1/4 of these sub centers do not have. And if you look at what are the gaps or the challenges that we have at the population, yes, we have a huge population of 1.2 billion to really look after, and people are not adequately aware about the services to reach to and the population in India is, of course, they do not have adequate paying capacity. So and a lot of people, they fall below poverty line because of the health expenditure, so they have no paying capacity, and so these add to. This is a slide which really hurts me, and why I just put this slide, because I think everybody who is in this conference or the workshop, I think, knows that India is going through a very severe pandemic right now, and I think it's just beyond imagination. We are having around 4 lakh cases a day, and with over 2 lakh deaths we already had, and I think the second wave of COVID has really shaken India in terms of. And that's how I can some of these headlines in the newspapers across India, if you can, or even globally, I think this total collapse of the healthcare system. And I think our healthcare system is not able to tackle the increased load of, so I think this is the additional challenge. India has already been at the verge of providing good quality, adequate healthcare facilities, and COVID has really collapsed us completely and the system. So, yes. So talking about the scope, yes, there is a scope. The government of India has been really working hard of actually improving the capacity of Indian healthcare facilities to make it more sustainable. This is a picture in illustration from the National Infrastructure Pipeline, from the report of the task force that came out in 2020, and they said a few points that you can see on the slide, like we need to really put forward the digital services, quality education, disaster resilience. But I think something that I found missing among in the entire report of the, I think that we really need to focus on being energy efficient and climate resilient, because India has a very varied geography, from drought-prone area to flood-prone area and extreme weathers. And I think it's very important that we need to be more climate resilient, and also, as I just, a lot of energy is being wasted. So because there is something called as Energy Conservation Building Code, EB. So according to that, many hospitals in India, they are around 42% of energy they can conserve, because they've been wasting energy in various ways. So they can consume around 42% of the energy consumption by various ways, and that ways could be they can shift from gas-based boilers and water chillers to more thermal-based plants and everything. But there are ways. So they are saying we're wasting a lot on energy. So we need. But I think I found something that this was missing in the entire document. I think we really need to emphasize on being energy efficient and climate resilient as well. And also the report says that the Confederation of Indian Industry, CII, quoted that 60% of healthcare facilities, they are not meeting the minimum criteria of EPI, Energy Performance Index, and that's the total energy consumption per unit of built-up area of the building per year. So I think it's something that we really need to think, and I think this should capture that. In fact, according to the LEED criteria, leadership in energy and environmental design, I think it's only few hospitals in India that has been able to meet the LEED criteria or ranking. So I think that's very important. So if you look at this program, that I think that I made myself, that we just need to have, I think, energy efficient and also climate resilient hospitals. And alternatively, we can use words like green hospitals that we are coming up in India. If you look at some of the reports that I read, we just have around 7 to 8 hospitals that are energy efficient, according to, and I think this number might have increased in a couple of years because the report was quite outdated. But yes, so what we need to focus is on space, cooling and heating, eliminating the energy waste in various forms, obtaining feedback from the hospital staff, from the patients, regulating temperatures, controls, you can keep out the zones. So we need to find out ways how can really make our healthcare facilities more energy efficient, and also the ventilation and the air, because that's one, I think the heating, the ventilation and air conditioning is the one that is taking maximum part of the energy, is something that we can really work on, and to reduce the water wastage in our health facilities. And also when you talk about green hospitals, hardly we have 10 to 11 hospitals. And I think most of these hospitals are the private hospitals. So the government hospital is something that we really need to work on, and how can we make our government tertiary level hospitals more green hospitals or energy efficient. So, and how can we really, and it's not just energy, I think the waste management, the water management, the lighting is something that we really need, and the air quality also. And particularly because of COVID, air quality becomes an indispensable matter, because when you really need to purify, because if I can say the recent Lancet task force report says that the COVID the virus is present in the air now. It's in the aerosols in the air. So air is, and anybody who is entering the healthcare facility who is not even COVID positive can contact this infection. So it's very important that we maintain this air quality in the hospitals. Being climate resilient is of course very important, because I just said that we need to make our hospitals more climate resilient. We need to adopt energy efficient solutions, more probably the green procurement, so that we reduce the greenhouse emissions, and also because India is vulnerable to power cuts, and so we need to save our energy. We should have alternatives like solar battery panels, so as to cut down the need, and also the greening around our hospitals and other various techniques that we can do, and also high efficient heating ventilators, so that we are able to meet the energy demand of the hospitals and not take them outside. And one thing that I would also like to add here, that that there is a scope, but the government of India is working a lot. Like they had some national building codes, as I just mentioned, energy conservation building code in 2007. Hospitals have to meet the BIS, Bureau of Indian Standards codes. For all these primary health centers, sub-centers, they have come up with Indian Public Health Standards 2012. NDMA, National Disaster Management Authority guidelines have come up. Heat wave action plan. So all these are the guidelines and action plans that have been put forward, that have been designed and developed. But I think they have not been implemented, or it's been implemented only by a few private hospitals, I think, and I think we're still a lot to do in the government sector. All we need is a comprehensive energy auditing, a proper energy waste management plan, and also perform EPI. As I meant, we don't have adequate data. As I just said, they said, the Confederation of Indian Industry said 60% of healthcare facilities that do not meet the EPI index. So I think we need to work out the facilities, we need to work with them, find waste, water use audit plans, waste management plans is something that we need to work on. And I think that way we will be able to come up with more, not only just to make our health facilities more sustainable, but also making them energy efficient, climate smart, climate resilient, and also important that we able to meet the needs of the communities. So that's all from my side, and I think the house is open for discussion. Yeah.
Thank you, Shantanu. Very interesting presentation. I think India is a very interesting country. You have a young population, people are getting it better. When you get it better, you want or require healthcare as well. I know there's political incentives to deliver healthcare to 500 million people more who don't have access to that.
Yes.
So as Daniel said before, it's an exponential demand of healthcare, and if more people need to will have access to healthcare, we need to provide that in a sustainable way. Otherwise, the climate or environmental impact will be too big.
Yes.
So I think you had some comments in the chat box as well. I would like to thank you, Shantanu, for your presentation, and we'll move on in the program as well. I think we just we'll have another presentation, and then maybe we'll take a short break. So the next presentation is Vera Siesjö, Senior Policy Advisor, Health and SRHR at SIDA. Supporting climate resilient and environmentally sustainable healthcare is the topic. The screen is yours.
Thank you so much, Johannes, and I'll try to keep you all up and awake here before the break. And thank you to all the presenters for really interesting presentations, and hopefully we have time for more discussions afterwards. But my name is Vera, and I'm a senior policy advisor at SIDA, the Swedish Development Corporation, and both for health and sexual and reproductive health rights. The intention of my presentation today is to shed some light on what SIDA is supporting when it comes to climate resilient and sustainable healthcare, and provide a little bit of a background of what are our different financing instruments. It's been fantastic both have Ian's presentations before here that sheds light on the overall sort of landscape and ecosystem of financing, and also from previous presenters that have actually presented of some of the work that we're supporting. So let's see. So I just wanted to give you a bit of background of the areas of work that SIDA is currently working in. I wanted to present you with this slide just for you to get an understanding of what are the themes that SIDA is currently focusing on. And I won't mention all of them, but I think what should be highlighted in this conversation is that we do work on environment and climate change, we do work on health, we work on sustainable energy, research and innovation, and water and sanitation. And I think interesting to the conversation previously, we really see that all of these are cross-cutting different areas, and they all sort of link into each other. We also have a private sector development aspect, so that might be interesting also for this conversation. And our partners range quite variably from civil society organizations, multilateral organizations, public sector, private sector, and research institute. So we have a quite broad partner portfolio in that sense. And we have about 35 different bilateral strategies, so with different countries globally, and then we have global strategies with mostly multilateral organizations, and then we also have regional strategies that might focus on themes, or they might focus such as human rights and democracy, or they might focus on specific other aspects as well, environment and climate change. So basically our environmental policy, this slide looks a bit strange to me, but I hope you can see it. Basically, what I wanted to say with this is that environment and climate change is part of SIDA's overall scope of work, and the way that we work with environment and climate change is basically that should really cross-cut every single area of work that we do. It should be integrated into all aspects of different projects supported to our different partners, and we drive this even through our own work. So it's really sort of core to the work that we do, and all work should be guided by these principles that are set up, instructed also from the Swedish government. So it's really a cross-cutting issue, and we try to work quite thoroughly within the organization as well to make sure that we really try to bind together different areas of work with environment and climate change, both through our policies, but also our different works. There it came. Well, so I think a lot has been said today about, obviously, I think we're all here in the agreement that the environment and climate change is, it's all sort of trying to break a vicious cycle of, environment impact affecting health and vice versa, and the pressure from sort of human activities that we have. And I think it's this is a very important part as I think just the last year has really shown what it means not to invest in healthcare and the problems that could cause globally. But also, I think this workshop really sheds light on the impact that the industry itself has and what we can do to reduce that. And I think, one thing that we see in SIDA again is this linked aspects and how we can work on that on a more sort of strategic level. And maybe just to say as well that, the way that we look at our different type of investments is also, our overall goal in SIDA is really to reduce poverty and to invest and support areas where we can obviously get the most benefit for the people that are most exposed to poverty and most exposed to environmental climate change and so forth. And so the way that we do that in a sense is also to really try to look at the holistic systems on how we invest. We have different tools when we look at our investment through multi-development poverty analysis, for example, which looks at different aspects of poverty. It's all well documented on our website as well, but that gives sort of the aspect on how we prioritize both countries' populations and support. And we also have different cross-cutting thematic areas, such as gender and so forth, that is part of this. But I think to the topic of the day, in a sense, and what I was a little bit asked to present on here is, how is SIDA financing different work? And I guess to start with, and just to add on to the previous presentation on financing, is that we as SIDA are governed by the Swedish government that sets out the priorities and the strategies on Swedish aid. And then SIDA receives this and decides what initiatives are needed to achieve the strategy goal. And there can be many strategy goals, obviously within the different thematic areas, within the different bilateral strategies, within the global strategies, and also the regional strategies. And then SIDA together with identifies partners to carry out these initiatives. And then in the three layers, sort of both the global, the regional, and the bilateral work that we do. And so we have different financing instruments, and I can maybe just stop before we think about this slide that I presented here, is that the majority of our work goes through the global, our global partnerships. And there we work with mainly multilateral organizations. So we have a lot of funding going to big UN agencies. We have a lot of funding going to different multilateral partners, as well as World Bank and so forth. And I'll go into that a little bit more afterwards. So that is a big part of our funding that goes to that. And we don't, as previously mentioned, support so much or provide so much support directly to companies or to small organizations, but we do that through our partnerships with multilateral agencies and organizations. So one of the sort of financing instruments that we have is challenge funds. That's one way that we support innovative practices and try to really make sure that we can support work to overcome the systematic lack of capital that we see in many developing markets, and really try to enhance innovation and specifically entrepreneurs working in this context, and that has a really strong commitment and drive to work towards more sustainable, long-term and sustainable solutions. And I just mentioned, I've just put together some of the different challenge funds that we do support. And I think maybe to the interest of this conversation today, the Sustainability and Resilience Fund is one that might be interesting. The DEMO Environment is another one, and the Global Innovations Fund is maybe a third one. But there's also interest in the other ones. We spoke about water and energy for food previously as also being a big contributor, and that's also one of the things that we support. And then just like who is eligible for these funds. So these funds are aimed at small and sustainable enterprises that are just starting out and really wants to expand in their market, and really sort of look at, you know, this what sort of hasn't been addressed before in the market, and where we can be have a more sort of catalytic approach towards achieving the overall goals and strategies of SIDA. So it's, you know, we can go in with these funds when it's more challenging markets or more challenging problems and issues that are being addressed, and where there's more risk in the investments. This is sort of suitable for these type of investments, and I'm happy to take questions on this afterwards. Another one is another financial instrument that we have is guarantee loans. This was just a slide from last year's portfolio. So we had about 40 guarantee contributions in 20 countries. 7 were global and 6 were regional guarantees. And we did this mostly in partnership with other, both bilateral, but also other organizations. And I guess, as you can see on the, I guess, your right side, we also, what sectors did we focus on? So you see health being one that amounted to 7%, but then infrastructure was actually 31%, and energy was 25%. So sometimes this is, you know, this sort of falls under different areas, and infrastructure for healthcare can also be under infrastructure in general. So I think that is important to remember when you look at this slide. And then you can see on the lower part of the slide, you can see in what regions we provided most of this guarantee loans. And so maybe just the guarantees is sort of, I think most of you, I guess, know about guarantee loans. I'm not going to take too much time, but it's basically a way to be able to finance and to assure a guarantee for specific loans, and sort of cuts out the aspect of insecurity or hesitancy from financial institutions to provide financing and loans to different projects and companies. So what we can do there is that we go in as sort of guarantees for these loans to make sure that there is that security for the financial institutions. And I think this slide just basically sort of demonstrates a little bit why guarantees is a good thing, and we see an added value both in terms of enabling mobilization and demonstration effects, but also really sort of to try to contribute to market development overall, specifically in these areas where we see a lack of investment or a lack of opportunities to get investment. And this came all together. I'm just going to flip them up, all of them. And guarantees can be used for many different benefits. And these are just a couple of examples of benefits where it could be used. I mean, as I mentioned before, it can enable local banks to enter new markets, such as lending, you know, to women or to small and medium enterprises, SMEs. It can backstop financing for multi-year and larger scale infrastructure project is another one, and lengthening the maturity of loans to SMEs, and also developing capital markets by facilitating local currency bond issuances. So I think that just sort of highlights a little bit the different financial instruments that we have to be able to support different projects, institutions, partnerships in general. And I think it was fantastic that I had my previous presenters, you know, really sort of providing a deep dive into one of the projects that are being supported by SIDA and SHIP. But we have many different projects that we do support in this area. The energy sector management assistance programs is also being rolled out in several different countries in sub-Saharan Africa, where we specifically looked at investments for healthcare facilities, making sure that they could be powered by solar energy. And we also made, specific commitments in terms of trying to assure that there were no specific that there was sort of long-term sustainability in incorporation with private sector entities as well. But we also do other type of investments, and this is more sort of, I guess, one you could say on a policy level, where we support the World Health Organization and give quite significant contributions to them, and specifically sort of looking at developing guidelines. There was quite a new guideline that looked at climate smart and sustainable healthcare facilities. So the World Health Organization comes out with these type of guidelines and policy documents that allows countries to adapt and implement and try to guide the overall development of healthcare infrastructure in the country. So that was one major, and we had the launch last year, I think in November, and we're hoping that many countries will now incorporate this into their overall healthcare strategies and make sure to try to incorporate the steps that are and the guidance that are provided by these type of steering documents. So that's another way that we also do support sort of at more policy level, I guess you could say, or overwatching, trying to change the landscape. Other ones is Water. I haven't put UNICEF here. Those are major organizations that we support in terms of access to clean water and sanitation. And I think very interesting, as one of the presenters was saying as well, sometimes, there's a steady lack of electricity in a lot of the healthcare facilities. And one of the work that we do is try to mitigate to see, because sometimes water is provided, and many times water exists in the facilities, but there's not energy to bring up the water on a continuous basis and bring up water. So that also sort of, there are a lot of bottlenecks at different levels of the whole chain in terms of running these healthcare facilities. UNFPA is another project that we support that looks at specifically climate crisis and looks at through the sort of more gender lens. So I think that just tries to provide a bit of an overview of the work that we do and how we support different organizations in this area, and what are some of the financial instruments that we can use for that. But maybe just add to the conversation, I think a lot of things were said about, healthcare facilities and, being a major driver of CO2 pollution as well. And I think one of the things that we're trying to look at SIDA is really trying to look at more distributed models of care. Many different countries go different ways in this. Some countries do build massive hospitals, and if you look from a health financing perspective, this is not a very sustainable way moving forward, as the cost of patients entering a tertiary care facility is extremely much higher than at the community level. So we're really trying to look at more integrated community-based care models that we can support, and not try to fuel sort of the massive sort of construction of major hospitals. I think that is one aspect that I just wanted to add to this as well. I think it's important to say in this conversation as well that community-based care, distributed care is shown to be much more effective and both cost effective, but also in really trying to prevent more serious health outcomes. And I guess finally, I would just like to say that I'm very happy to be in this conversation, because we do look for different ways that we can support innovative solutions and innovative collaborations. And although we have a big part of our financing structure that goes to major multilateral organizations, I think there's absolutely an appetite to try to see how we can partner in better ways moving forward, both working with the private sector, non-for-profit private sector and private sector, and try to find innovative ways. We have done this in other ways as well, on specific ICT solutions, information communication technology solutions that are looking more at the monitoring aspect and the data aspect I was also mentioning is a sort of prerequisite for how we can operate and really make sound judgments in a lot of these contexts. So I think I'm about time, and just thank you for this time and look forward to any questions or discussions afterwards. Thank you.
Thank you, Vera. It was a very interesting presentation, and I think gave all of us insight in the structures of possibilities for financing. Would like to go back to Donna's presentation where we're talking about sustainable healthcare going across different sectors, and also that healthcare can be a tool to create the demand for infrastructure as well, but it's a broader system solution approach. How does that fit into the different like financing models? Is there the different silos here? Can these different departments of financing collaborate in some way, or can there be one financing type, or do we need to look at different types to make a puzzle to get all the aspects in of sustainable healthcare?
No, there are absolute ways of integrating these aspects and looking at a sort of more cross-sectional type of financing or I guess a pooled financing model in that sense. So there's definitely those opportunities as well to look at that type of financial models. But I guess, I mean, for SIDA, it's really about, you know, trying to see what can drive, what are the solutions can drive that change long terms. And we do have, as I mentioned in the beginning, we do have a lot of different areas, thematic areas as well, everything from sort of private sector development to trade to I mean, integrated with climate change and so forth. So there's definitely opportunities to look at how the investments that are made in one area could be, you know, shared with other areas as well. So yeah, that opportunity is there.
Yeah, thank you, Vera. Thank you very much. I would like to for all the speakers, you have received some questions in the chat, so you can have a look in the chat and give some answers, so we can. I would like to go in further in detail here, but we have to follow the program. We'll have a short break, 5 minutes, so we'll be back at 3 o'clock for more presentations and the panel discussion. So you can have some time to get some coffee right now to fill up your energy a little bit. Okay, so see you back at 3 o'clock.
Okay.
Or in 5 minutes.
Thanks.
Yes, so welcome back after a short break. We'll continue in the program now. The next speaker is Dr. Josefine Sundqvist, the new Secretary General at LM International, or also Läkarmissionen in Swedish. She'll talk about a bottom-up approach on sustainable healthcare. So the screen is yours, Josefine.
Thank you so much, Johannes, and thanks to all the other speakers and contributors here in the workshop. We are super excited to be part of this workshop today, and I'm here together with my colleague Andreas Zetterlund. Maybe you can just say hi from your side.
Hi there, good to be part of the meeting. Good to see you.
And the two of us will make a joint presentation now. And just to mention a little bit background of myself, I started as the new Secretary General for LM International yesterday, but I've already managed to do a lot of work because we're in the midst of a lot of exciting new opportunities. And we're also facing, of course, challenges related to the global health crisis and other ongoing always challenges. But it's exciting to start up. And my background, I just recently finished my work with SIDA. I've been there for over a couple of years, working together with Vera, who's here in the workshop today. Before that, I have a background as researcher, and I've done research on health systems and the strengthening of health systems, and also on social norms in health systems. And there I always conducted my research from a sort of a community-based approach. So I've seen a lot of the district hospitals and facilities and the type of everyday challenges that has been addressed from different parts of the world in today's workshop. And just to mention quickly about who we are, because this workshop is also about situating the scene. What could we possibly do together as finance institutional donors, tech companies, platforms, health companies, or development actors? And we're a humanitarian and development actor. If we continue, Andreas, with the next slide, just to get a grip of who we have around 300 staff members working for LM International around the globe. We have a regional office in Dubai, where we work in Yemen, Afghanistan, and some related countries. And then we have a regional office in Addis Ababa in Ethiopia, where we work in Sahel, Horn of Africa, West Africa, a regional office in Kampala for Eastern Africa and Southern Africa, and a regional office in Miami for Latin America. And we have our own country offices in 10 countries, but we also operate in 30 countries where we have a lot of local partners. In Stockholm, we are around 40 people in our HQ, which is the office for Sweden and Europe, but also global office. And we are just forming right now a new unit in our office for global innovation and digital transformation. So innovation in health systems is something we are really prioritizing right now in our current strategy for our organization. And we're playing an active part in Swash and Grow. The S is missing there, which we have heard about in the workshop. And we have also worked extensively with the Sustained platform that has now been overtaken by UNOPS. If we look then at LM approaches to innovation and digital transformation in sustainable healthcare, what is both our core principle, our ways of working? If you look at us, for example, me and Andreas in this workshop, we have both spent extensive time in local communities on the African continent. And that is something that is really important to stress, that we are really working from bottom up. So we are not delivering down large-scale solutions for a number of countries at the same time, but we always originate from the local community and design solutions in relation to local needs and ideas. And there we have a human-centered design and also rooted in our community-based approach. And as I wrote, we can see ourselves that we have been on an innovative journey since 1958, because that's when we started as an organization. And actually, when I lived in the Democratic Republic of Congo in the 1980s, my own parents was working for LM International with developing new technology in hospitals in Eastern Congo, Kivu province. So we have done this work for a long time, but we haven't really had this base for sustainable, innovative solutions. So working more transformatively and acknowledging that planetary health is the base for everything we do. That is something we have come to learn over the years. And we also find it important to be end user driven. So for us, what it means to work from a right-based approach, it's basically listening to people that are living in communities in poverty, but not only listening to them symbolically, but also acknowledging that often they have a lot of know-how what materials could be accessed, what actually works in the different local context. Sometimes we work in desert areas, etc. Also, we work from a transformative approach. So we believe that status quo is not a solution, but we have to constantly live with change. For us, it's important to find cost-effective solutions, because since we work closely with local communities and people living in poverty, we know that if we work with business modules that are not cost-effective, we can only reach out with health services to the upper middle class in rich urban context. And we also need to acknowledge that a lot of population and users for different solutions are living off the grid and in different parts of the countries where we work. So therefore, we need to see how can business models become cost effective for people living in poverty. For us, it's also important to be adaptive to context. And we have seen when we have done our work in countries like Sudan, Ethiopia, South Sudan, DRC, that these countries are constantly changing from one day to another. And within development cooperation, we always come back to the concept around triple nexus. And for those of you who may not work primarily with development, you might wonder what is triple nexus. But it's basically acknowledging that today development aid and humanitarian aid and peace building are two separated fields. There aren't enough strong interlinkages in between. So if an area is affected by a natural disaster and becomes an humanitarian zone, there is a new type of logic that will get in, and new actors will come, and we will have a new actors field. And there is a risk with these type quick changes in the context that we don't find sustainable modules, business modules, solutions with the communities that can last over time. So therefore, we have to bridge the gap between humanitarian and long-term development. Finally, in our approaches, I just want to mention the partnership approach. We always work in partnerships, both with local rooted actors, but also innovators, companies, institutional donors, UN agencies. We believe that the more partners we bring on board, the better it will get and the stronger results we'll have. So I'll finish there and hand over to Andreas, who will just mention something quickly from our countries.
Yes, thank you, Josefine. So my background is from the field. I grew up in Sudan and Kenya, so a lot of my work is really from a field aspect. And so I'm heading the unit now for innovation here at LM, and so a lot, of course, is also linked to the water and sanitation aspect when we talk about healthcare. So I'm sure we'll talk more after this meeting as well. But you said a lot, Josefine, about how to make use of the local know-how around these issues. And I think that's what I've been discovering in those networks that I sit in, that many times it's very hard to get that feedback into the solutions that we try to design, that we many times miss the local context that we work with. So that's what I bring in, a lot of that experience from the work I've done, and we hope that this unit will see how we can bridge. I like the picture Daniel Eriksson showed about the silos. It's very typical, and being a humanitarian and development actor in this field, we see the same thing in the work we do. So it's really important to see how we can bridge these silos that exist. I can also just mention briefly that we've been doing a lot of water mini yards for health centers and hospitals, where we have solar-driven pumps. And of course, as we set up these solutions, we we see a lot how the improvements that we can do in healthcare systems. So those are a couple of things that I just wanted to mention, and things that we'll be looking into in the unit I'm heading.
Yeah, thank you for the presentation. It's very interesting to hear the on the ground perspective and to understand the situation and how you're working. And yeah, back to the silos again. The idea here is a little bit when listening to LM International, MAMTA, and UNDP is that you are on the field. You are detecting where you need to provide healthcare. And if we in some way can have an organization behind that provides the systems, the clean water, energy, and waste handling and so on, that makes it possible for you to give safe healthcare. Then we can have a pipeline, so to speak, to promote health around the world, and collaborate and streamline the organization behind, so it will be more effective and safer investments for the financiers as well. So it's a very good inputs. So yeah, thank you, Josefine and Andreas, for your presentation. We will move on again. I'm sorry to be so short, but we have many things to discuss. And now we are moving into the company side of the on the company side. So the next speaker will be Olsson, Head of Sustainability at Link Arkitektur, and Mikael Pontoppidan, Commercial Director and International Architect at Link Arkitektur. And they will talk about impact architecture, holistic sustainability in healthcare projects. The screen is yours.
Thank you, Johannes, and thank you for giving Link Arkitektur the opportunity to take part in this important talk. My name is Vera Olsson, and I'm Head of Sustainability at Link Arkitektur, and me and my colleague, Mikael Pontoppidan, will give you a short presentation and introduction to how we work with sustainability and how we support sustainable development through our architecture. So thanks again for letting us be part of this meeting. And I hand over to you, Mikael.
Yes, thank you from me as well. As I don't know how many of you know about Link Arkitektur, but as one of the largest architectural offices in Scandinavia, we call ourselves welfare architects, as people live and socialize in the environments that we design, whether going to work or gathering in the square, or indeed spending time in a hospital. And we acknowledge that the scale of particularly our hospital projects put a certain responsibility on us as architects, a responsibility to optimize on sustainability when we design and develop master plans, campuses, and new hospitals. In the past, we've done it mostly in Scandinavia, but we are looking to expand to markets outside of our home markets as well. And our ambition is always to create inspiring spaces for better lives and to provide sustainability in all aspects of our work. And just to give you a very brief introduction to Link, we're a Scandinavian architectural business with 15 offices across Scandinavia, 500 people. And roughly a third of our production is within hospitals and life science. The way we see it, the potential sustainability impact of the built environment is enormous. And because hospitals are often such big entities, they make up a very important part of delivering on this potential. As hospital architects, we must think in a holistic way to ensure an equal focus on, of course, logistics in a hospital, healing architecture, but more and more importantly on sustainable solutions to complex technical challenges. And this is in essence what we do as hospital architects. And of course we want to go to new markets to expand our business, but we also want to do this because we think we can actually make a positive difference in exporting our key competence within hospital design. We're currently looking at Europe, Africa, and the Middle East, but the sky is the limit. And the way that we approach hospital design from a sustainability point of view is, of course, based on our Scandinavian competence, and it ensures a constant focus on both social and environmental sustainability. And we believe that in combination with our strategy around what we call impact architecture, that we can actually do more good. Of course, our competence is set out from a Scandinavian or Nordic skill set of a welfare-based architecture, and this has taught us many valuable lessons that we want to offer to the world in a way of thinking sustainable hospitals to new markets. And as people have mentioned in previous talks today, the building industry is heavily linked to finance and getting capital for projects, and clients are of course always keen to get bang for their buck. But we at Link, we believe that this impact focus can be approached from more than one side. And Per will be telling you more about how we at Link take on impact architecture, where we try to learn from the financial world by taking a structured approach to sustainable development and value creation in our projects. And that's how we at Link hope to be maximizing on societal benefits from our clients' investments.
Thank you, Mikael. So over to about our sustainability work and our focus on impact architecture. So we can see that sustainability has for a while been moving from being about doing less harm to now being more about identifying the full potential in relation to sustainable development and delivering positive impact and contributing to solve the societal challenges. So in relation to the built environment, there is a huge potential when investing in built environment to address and influence positively some societal challenges. We can see that the built environment and the construction industry has a big negative impact, especially then on ecological sustainability. And we can also see that designing and programming the built environment can actually have quite a big impact on social sustainability also. So the building environment and the construction industry and the architectural industry has a big potential in actually delivering more good than what we're doing at the moment. So by using a holistic and impact-focused approach to sustainability, it's actually possible to increase the positive impact of the built environment in relation to the specific context of the building. So for Link Architecture, more good is the base for our work with sustainability. The societal challenges differ between markets, geographies, projects, but the framework and the mindset for creating impact architecture is the same. As Mikael mentioned, we have somewhat been influenced by the financial world and the investment focus named impact investing when developing our sustainability focused architecture. And investing in our world should be designing of the built environment with the intention to generate measurable, beneficial, social, or environmental impact along financial return. Of course, that can also be social economic values and other value creations, but that's an important part to actually get sustainability to happen in the projects and creating a good base for upscaling of solutions. So to reach that ambition, we try to evaluate our sustainability work and our focus in our projects with the help of 3 aspects. So first, we always try to look at the potential of the built environment in relation to solving some societal challenges. So what are the societal challenges that the project and the built environment could impact positively? And then, of course, we look at how can we, as architects, have an influence on actually delivering on those societal challenges, because there can be a potential within built environment or within the construction industry, but there is just certain areas where we can influence through our architects. So that's an important base to create. And then to make sure that we get a good driver behind our sustainability work, we always try to look for the value creation. But it's really important that we focus first on the base of the pyramid and then look at value creation. So we really focus on the areas where we can do the most in relation to solving the societal challenges. And of course, we take, when it comes to societal challenges, the global agendas like the Sustainable Development Goals and the planetary boundaries and the Paris Agreement are very, very central in our development of our sustainability work. But it's really important to always, not one size fits all, but always take the specific project and the context of the project into relation. So look at what kind of building, what kind of location, what societal challenges in that specific context can we as architects make a difference. And when looking at our context from our home markets perspective, we have a purpose to always create spaces for better living. And that we do through our experience and our knowledge in relation to the architect's quality of architecture in relation to function and design. For example, when it comes to hospital, we create the better space or the spaces for better living while having a good knowledge in relation to that specific area. But it's also an important focus to deliver on social sustainability. And when looking at our home markets, we are focusing on safe environments, health and well-being, and livable environments. And equally important, of course, is to always secure that we're trying to lowering the negative impact of the built environment in relation to ecological sustainability. And there we can do that the best if we are focusing on circular architecture, climate smart architecture, but also biodiversity. These are areas where the built environment and construction industry have a huge negative impact. So it's so important to always have that in mind when we are designing to lower the negative impact on those areas. And in that way, we can deliver both broadly, but also on depth when it comes to a couple of the Sustainable Development Goals, where we can have the best possible deliverance on impact. Just to give you a little view on how that can be applied on a hospital design. Of course, the first prioritization is looking at how can the hospital design support and add to the work of the hospital staff. It can be in relation to health and well-being for decreasing the spreading of bacteria, quicker recovery, but it can also be how the logistics in the facilities can support staff, operation, and materials. But it can also be creating facilities that support staff, science, and business to meet and collaborate and develop the future healthcare of the healthcare of the future. And of course, always looking at ecological sustainability, securing a resource-efficient construction, operation, and maintenance, a low carbon footprint, a possibility to produce renewable energy, and a resilience in relation to operations and effects of climate change. And the clock is ticking, and focusing on the actual impact of what we do with the built environment is crucial to deliver on time on sustainable development. So thank you for giving us the opportunity to talk at this important meeting.
Yeah, thank you, Per and Mikael. It was a very interesting presentation, and I think the architectural perspective of system solutions and how the hospital can be integrated in the society is all looked at it from the architectural perspective. So it's very interesting to have that in this discussion as well, and also with a financing perspective as well. So I would like to thank you once again for your presentation, and if you have any questions to Per or Mikael, you can write it in the chat. We'll go on to the next presentation. Valentin Monteiro, Director Business Development and Sustainability at Schneider Electric.
Hello everyone. So thanks a lot, Johannes, for introducing and for this opportunity to present today a bit of what we do at Schneider Electric, and quickly about myself. So I'm Valentin Monteiro, and I'm kind of leading, let's say, what we call business development and strategic partnership and sustainability for Schneider Electric Sweden, so based in Stockholm. And as we discussed, or like all the other participants already introduced a bit, there is, those days more and more focus on sustainability and how does that affect also hospitals and how can we work with that. So I will try to give you a brief introduction about how Schneider Electric, as a technology provider for energy management solution, can actually contribute to with digital solutions for sustainable and efficient hospitals. But before we start, let's say, jumping into like real cases for hospitals, and we will come to that, I just would like to connect a little bit with what Per was mentioning like 2 minutes ago when it comes to climate change and talking about CO2 and carbon footprint. Because as you have understood and as we've discussed, and as you know, working on the carbon footprint and reducing or at least limiting the carbon footprint is actually a key element to also preserve the future of human health. So it's key to understand where it comes from and what we can do about actually the carbon footprint even in a hospital. So to introduce that, just a few elements about what we are talking about to put things into perspective. When we talk about electricity, for instance, or energy in general, but in that case electricity, and hospitals, using a lot of electricity for the operations of the facility, of course, we talk roughly about 475 grams of CO2 in average worldwide. It depends country by country, but in average in the world, that's what we talk about for 1 kilowatt hour of electricity. If you compare that, for instance, with 1 kilometer driven with average car, it's about 150 grams. And if you compare that again with another metric we could have in mind, if you, let's say, avoid the production of 100 grams of plastic, we are talking then about 600 grams of CO2. So just to have some kind of order in mind. And why is it also interesting in the discussion? It's because, let's say, the solutions that we can put in front of that are not the same kind. So basically, and how we can contribute again, like for instance, Schneider Electric to support a hospital in that case. So when we look at the electricity part, and it has been a lot discussed already today, we are looking a lot at the energy efficiency aspect, or also the energy productivity aspect, meaning how can you reduce the number of kilowatt hour that you need for the same purpose or for the same utilization, and also how can you maximize what you get out of 1 kilowatt hour of electricity or of energy. So we will zoom into this one later, but basically we will use a digital solution to enhance that. The second one, it's more about, okay, how can we reduce the number of kilometers needed to be driven? So, working with digital services or remote operations more and more. It was a different case also presented earlier today regarding how we can, digitally do some kind of the activities that needs to be done on a healthcare system. And also talking about e-mobility. So how can we, for the remaining kilometers that need to be driven, how can we electrify them to also reduce the carbon emission of them, depending places by places, again, country by country. And then ultimately, it's more about, okay, how can we work on the design of technologies and products to reduce kind of the embedded footprint of those products, and also extend the life cycle, make them more circular, so that we also reduce this in that context. But now zooming a little bit on the actual digital aspect and how we can leverage digital technologies to really increase this capacity of efficiency and sustainability. What we are doing again at Schneider, being a technology provider, so we are trying to look and to leverage those three trends that you see here on the slide, which is the growing let's say market of IoT and the capacities of IoT, so the Internet of Things, the connected products and all the platform linked to it, which is growing. So more and more, let's say, products and equipment and technologies are getting connected, which is generating a very big amount of data. So we are talking about big data more and more. And ultimately, the fact that now we get more and more capacities with artificial intelligence to actually master this data and make good use of it. Because for many, many years, and it's still a bit the case today in some circumstances, we have a lot of data, but do we have a good, let's say, usage and leverage of those data? So that's a bit what we are trying to do and to simplify at Schneider Electric with what we call EcoStructure. And the concept is fairly simple. It's what you see here on the screen. It's the idea that we start by connecting, all the equipment, all the products, all the operations basically happening in a hospital, for instance. Then from connecting them, we collect the data, which are generated by the connected equipment. And then we analyze those data, leveraging also artificial intelligence capabilities and all these type of features that we can leverage those days to ultimately be able to take action. So it could be either remotely or locally by the end user, by different operators and so on and so forth, in order to close the loop and to maximize or make the overall operations more efficient, leverage the capacity of the hospital and all these kind of things. So if we look concretely speaking at what it could bring, for instance, so I have two cases actually from Sweden that we could quickly look at. So this one is a hospital in the northern part of Sweden, where we have installed a kind of an EcoStructure installation, as you can see a bit on the left part of the slide, with different products and equipment. I will not go into details, but basically it's covering both the building automation part, so on the heating, cooling, ventilation, and so on and so forth, and also on the power distribution, low voltage and medium voltage within the hospital. And leveraging, let's say, all the connectivity and the analysis of the data that we could get thanks to that, you can see a bit on the matrix on the left, on the right part of the slide, sorry, that we were able to basically reduce the number of complaints because basically, for instance, all the temperature and the different flows in the hospitals were handled in a much better way. When there were complaints, they were actually also handled in a more reactive way because there were a lot of follow-up tools and so on, which were working in a better way, more, let's say, fine-tuned and customized for the users of the hospitals. We were also able to manage to lower the energy cost a lot because they managed to map very well and in a very granular way how they are using energy and where in the actual hospital. And ultimately, they were also able to reduce the number of unscheduled maintenance because they were doing a preventive maintenance plan, or they are doing preventive maintenance plan now, based on the actual data and the condition of the product, which is available anytime for the different system. We have another one, actually, a bit of a different case, but with a similar type of solution in the southern part of Sweden. And here, without going too much into details, what we did was, by discussing with the customer, we identified that one of their pain points was that they had too many systems. And basically, they wanted to simplify that because they were not really able to even know what to find, where, in which system, and so on. So we had like a long, let's say, discussion with them for different workshops, very, let's say, interesting and valuable one. And we proposed them like a step-by-step roadmap to converge and map like all their systems and kind of go towards one single system when it comes to facility management, where they will have all the data that they need and where they could also get the visibility of the result and the actual investment that is being done. So when you see some kind of metrics here and there on what has been done. And I will finish very quickly by this one, just to mention that what I was showing for Sweden is not, let's say, something that we do only in Sweden or only in Nordics. It's really something that we can replicate worldwide due to the fact that Schneider Electric is also a global company, very well present all around the world, actually. So this is a very similar case in Indonesia, for instance, where we have deployed a similar type of solution and where you can see, for instance, without going into details, the savings that they generated per year due to the optimization and the efficiency that they were able to tackle with that. So I will stop here, as you have understood. So that's what we do at Schneider. So making the most of our energy and resources, and that's what we call life event. So if you have any questions, I guess we have maybe 1 minute for that. Or over to you, Johannes.
Yeah. Thank you, Valentin. Yeah, it's interesting to look at the measuring the systems and combining different systems as well. It gives more savings and the control over the buildings. And I think if we are looking for a system solution approach, then you have to understand the building's performance in a bigger context. So it's very interesting to get your view on how to monitor the buildings. Yeah, so I would like to, if you have any questions to Valentin, please ask them in the chat, and we will catch up in the panel discussion in a minute or two. We will keep on going to the next presentation, which is John Nyberg, Pure Biosynergy, Circular Water and Disinfection Solutions for Healthcare.